All right, so now let's say that you've failed non-operative management for knee replacement and are considering having knee replacement surgery. So with knee replacement, there are risks. Some of the more common risks associated with knee replacement is that you can still have pain inside the knee, which is the whole reason why you're having the knee replacement surgery, is to address the arthritic pain. Doesn't always fix it. About 20% of the time, patients still have some residual pain with knee replacement. There can be issues with wound healing. If you're a diabetic, if you have nutritional problems, sometimes the wound can heal in a delayed fashion, which could put you at risk for having an infection. Even if you don't have wound healing problems, you can still have an infection after surgery. Depending on how aggressive the infection is and how soon it's caught, it can either be treated with antibiotics or sometimes revision surgery, meaning you reopen the wound in the knee, swap out components. Sometimes you need to do this twice, sometimes you do it once, depending on how bad and how aggressive the infection is. Another potential complication, you could have nerve or vessel injury. In the back of the knee, there's some nerves and vessels. Also on the side of the knee, there's another nerve here. So depending on the type of deformity you have, if you have severe valgus, which is a knee in this position, as you correct the deformity, you can put tension on that nerve that could result in paralysis or weakness of the muscles associated with that nerve. That's also another potential complication. Another potential issue is loosening of your components or the implants. Can happen with time. And in general, we try and wait till you're after 55 and even older to do the replacement, because the younger you are, the more mileage, the more wear and tear that the implant sees, the quicker it is likely to wear out. If that happens, it's a revision surgery. The outcomes aren't as good as having the index procedure or the original surgery. So that's another reason why you don't want to have knee replacement when you're relatively young. Another potential issue with knee replacement surgery is something called arthroplasty. This is where the knee stiffens up and you have a difficult time bending and extending the knee. Typically, you start therapy within a week to try and prevent this from happening. Another potential risk is blood clots or DVT. Patients are typically put on some type of blood thinner to decrease the chance of this happening. Usually around 6 weeks after surgery, patients are on it. Even if you're on it, you can still develop blood clots. So that's another potential issue that can occur with knee replacement surgery. And then the total recovery time, the first 2 to 3 months are probably the worst. You're in therapy the entire time, and after that, you continue working with therapy. The goal to be to try and get as much motion and as much strength back in your quad and your hamstring as you had before. So total recovery time can be up to a year depending on how you progress.